Electronic health record, EHR for short, is a collection of electronic health information about an individual patient or population, and is capable of being shared across all different types of healthcare settings. With that said, there are several advantages and disadvantages to having such a system. One clear advantage is that you do get accurate, up-to-date, and detailed information about patients, as patients are able to directly input their data into the system, whether it's by email from a doctor or directly off their website. One disadvantage to having EHR systems is that you do need the hardware necessary to carry out these electronic fill-in forms. So let's say if a small office doctor forgets his electronic device, his iPad or a laptop, then information gaps may start to appear, as you do have to resort to the old system, which is just paper. With electronic health record systems, you can restrict fill-in forms and have them necessary to fill in before carrying out to the next step. While on paper forms, people often just leave out viable information.
This week's topics revolve around the potential dangers and risks associated with integrating technology in the healthcare system. While reading the articles and listening to lecture, I had a few concerns and questions pop up in my head. One big question I had is how secure is the information that we provide healthcare providers? Electronic health records are becoming the standard way of recording and accessing patient information throughout medical care facilities. The system provides an efficient way to look up, share, and analyze patient records. However, this raises a concern that there's an abundant amount of patient information within the system, and corporations worldwide are finding out more and more ways to be able to monetize people's data. Are these electronic health records immune to this threat? Furthermore, because so many aspects of healthcare are privatized, it seems that there will be always the danger that corporations care more about profits than the people they serve. This could lead to richer clients getting more security and more protection over their data than poorer clients. The other big question I have is how would the healthcare system standardize its many different healthcare technological systems? The articles talk about the concern of integration within the US, but how will it handle global healthcare? People are traveling frequently around the world now and can get sick anywhere in the world. If there are problems with integration just within the US, it seems as if there will be enormous problems integrating records globally. The adaptation and integration of technology within healthcare has many advantages, but there must be standards and laws implemented that preserve patients' rights and allow for seamless care for patients globally.
CPOE systems have improved since its creation, but it still has failures as high as 39% when failing to send alerts for potentially harmful drugs, and a 13% failure rate for potentially fatal orders. The proposition that Leapfrog, one of the major coalitions that distributes the CPOE systems, has advised is that hospitals double or triple check their CPOE systems. One of the complications that come with this plan is that many physicians and medical practitioners may learn to just dismiss the alarms. I believe that CPOE systems make a very strong case for reducing medical errors, which is one of the major problems as it makes up a concerning amount of annual deaths. If CPOE is going to work, I believe that hospitals need to begin to expand training for staff so that they can use the CPOE systems, and also to create a system of accountability to ensure that there are less careless mistakes when using the system. Similar to CPOE systems are the EHR system, which is a system that combines the data from multiple different services such as pharmacy and radiology. It is also extremely fast, detailed, and accurate. This makes EHR an extremely important tool because of how much information can be readily accessed. Despite that, EHR is very susceptible for hackers, and this information can be held ransom. Because of that, I believe that EHR deserves more funding to ensure that information can be harder to steal. Like CPOE, EHR really has the potential to revolutionize medicine.
Hi, my name is Ivy, and in the Leapfrog video, the article mentions that improvements in the CPOE system from 2014 till now has been stagnant. The article also tells us about how physicians are possibly inputting incorrect medication orders. From a design point of view, I first thought of why the physicians are making so many mistakes. If physicians are required to manually update a profile for a patient, for example, an order or a note, then the system first needs to revisit usability and test again if the user interface is optimal. If the system itself is faulty in this sense, then I believe there should be another alternative or even recall of the system to encourage more health institutions to implement it in an optimal way. I think the main problem here is the fact that improvements are very stagnant. This means there is room for improvement, but we can't think of a single clear-cut solution because the bigger a system is, the more complicated it can be trying to address issues. Still, I believe we should try our best to tackle this issue and make a friendlier, more efficient user interface for the software.
Overall, we can see that the technologies discussed of the EHRs and CPOC systems allow for many benefits in the healthcare system, streamlining the doctor-patient experience. However, we must be cognizant that these are still developing technologies and have the potential to produce errors or be compromised, so healthcare professionals should always double-check what a system may tell them to ensure that the patient receives the best care possible.